Starting with the differentiation of forceps and scissors. The two prongs of these equipments cross each other, so it is a scissor, while the two forceps of these instruments do not cross each other, they just come alongside of one another, so it is a forceps. Are, as they do not cross each other, these are the forceps, and this one is a small forceps, and this one is a big needle holding forceps. Here I have three equipments, and all these are the scissors. As they cross, the two prongs of these equipments cross each other as seen here, so all these are the scissors. And to differentiate from one another with the help of their size, we can differentiate. The first one is venous scissor, second one is corneoscleral scissor, and the third one is conjunctival scissor. As you differentiate from the smallest one, middle one, and the largest one, this is for cutting the anterior capsule of the lens. As name mentioned, this one is for the cutting the corneoscleral, and this for the conjunctival purpose. These three instruments are related with the lacrimal sac. The first one is the punctum dilator, the middle one is lacrimal cannula, and the third one is lacrimal probe or Bowman's probe. The punctum dilator is used to dilate the punctum and canaliculus during syringing, probing, and this lacrimal cannula is used during syringing of the lacrimal passage, and the lacrimal probe or Bowman's probe is used to probe nasolacrimal duct in congenital blockage. These three equipments are the retractors. These two equipments are the Desmier's retractor, and this one is the cat's paw lacrimal wound retractor.